Hey everyone, today we're opening up the Ultimate Rescuer's Playbook to bring you an essential explainer on the critical first aid management of burns and scalds. In a split-second emergency, knowing exactly what to do, and just as importantly, what absolutely not to do, can literally be the difference between a quick recovery and a lifetime of complications. I'm really excited to guide you through this material because this is exactly the kind of practical, structured knowledge that genuinely saves lives.
So let's take a quick look at our roadmap for today's explainer. We're going to cover 1. What are burns and scalds? 2. Classifying burn severity. 3. The 6P danger signs. 4. Immediate fire rescue steps. 5. First aid, what to do. And 6. Crucial mistakes to avoid.
All right, diving right into section 1, what are burns and scalds? Now, you might use these terms interchangeably, but notice the stark difference in the sources here. Burns come specifically from dry heat. We're talking about direct open flames, a lightning strike, an electric current, or touching hot metal. Scalds, on the other hand, are injuries caused strictly by moist heat. Think of boiling water, pressurized steam rushing out of a pot, splattering cooking oil, things like that. It's a subtle difference in the source, for sure, but both require immediate, careful attention. Moving on to section 2, classifying burn severity. Let's break down the 4 degrees of burn depth because understanding this is absolutely vital. A first-degree burn is superficial. It only involves that top layer, the epidermis. The skin's going to look pinkish or reddish and dry, and yeah, it's painful to the touch, but it usually heals up on its own within about 7 days. Now, dropping down a level, a second-degree burn goes deeper. It hits both the epidermis and the dermis. The skin here is bright red, swollen, and looks kind of shiny or wet, but the absolute hallmark sign of a second-degree burn, blistering. It is extremely painful because those nerve endings are completely exposed and irritated, and you're looking at about 2 to 3 weeks to heal. But here is where things take a really severe turn. When we get to third-degree burns, this is a full-thickness injury involving the subcutaneous layer. The skin looks charred, black, leathery, or even completely white and dry. Now here's the crazy part. It is often painless at the center. Why? Because the nerve endings have been completely destroyed. This level of trauma usually requires a skin graft to heal. Finally, a fourth-degree burn is catastrophic. The tissue is literally charred away, exposing deeper anatomical structures, like muscle and bone. There's absolutely no feeling of pain at all due to total nerve destruction, and this requires extensive surgery and intensive care. It's a wild paradox, right? The worse the physical damage gets in the third and fourth degrees, the less pain the victim actually feels. Our next classification method is total body surface area, or TBSA. This basically categorizes the injury based on how much of the body is actually affected. You don't need to memorize every single number listed here, but I want you to look at the massive difference between the demographics. While a healthy adult might sustain a quote-unquote minor burn at under 15% surface area, that threshold for children and the elderly drops down to less than 10%. This illustrates exactly why we have to be extra vigilant with vulnerable age groups. Their bodies just simply cannot handle the same surface area of trauma as an adult. Which brings us to section 3, the 6P danger signs. Okay, the crucial takeaway here is memorizing these 6 Ps. If you're observing a burn victim and you spot these signs, you are dealing with an incredibly dangerous limb-threatening complication known as acute compartment syndrome. Here they are. 1. Severe pain. 2. Paresthesia, which is just a fancy word for that pins and needles tingling sensation. 3. Paralysis, or the sudden inability to move the affected area. 4. Poikilothermia, meaning the limb feels abnormally cool to the touch because it's failing to regulate temperature. 5. Pallor, where the skin turns visibly pale. And 6. Pulselessness, meaning you can literally no longer find a pulse in that limb. If these 6 Ps are present, the swelling has trapped immense pressure inside the muscle compartment, entirely cutting off blood flow. This isn't a wait-and-see situation. This is a massive medical emergency requiring immediate hospital intervention. Let's jump to section 4. Immediate fire rescue steps. This sequence right here is your ultimate rescue tactic. We've all heard stop, drop, and roll a million times since we were kids, but here is the life-saving why behind every single step. Step 1. Stop. You must tell the person to stop running immediately. Why? Because running literally feeds fresh oxygen to the fire, making it burn hotter and faster. Step 2. Drop. Have the person drop completely flat onto the ground. Fire burns upward, right? So by dropping horizontally, you're protecting their face, their neck, and their vital airways from those rising flames. Step 3, roll. Have them roll back and forth on the ground repeatedly. That rolling action actively presses the burning clothes against the hard ground, physically smothering the flames. And finally, step 4,
Wrap. Wrap the person tightly with a thick piece of clothing or a heavy coat. But, and this is key, it must be heavy and non-synthetic. So absolutely no nylon or polyester that can melt straight into the skin. Wrapping completely blocks the air and starves the remaining fire of the oxygen it needs to survive.
Section 5. First aid. What to do. Once the fire is out, remember the 3 C's for actionable first aid. First, cool. You want to cool the burn using cool, gently running tap water. Don't blast it. The goal is to bring the underlying tissue temperature down safely to stop the burning process. Because believe it or not, tissue continues to burn even after the heat source is completely gone. Second, clean. This step gets forgotten all the time, but it is incredibly critical. Remove tight items like rings, watches, or bracelets immediately. You have to do this before the swelling starts. If you wait, that swelling is going to turn a simple ring into a literal tourniquet, cutting off circulation of the fingers. Third, cover. Cover the burn loosely with a clean or sterile non-stick cloth or gauze dressing. Do not wrap it super tightly, and definitely make sure the material isn't something fuzzy that will shed fibers directly into the open wound.
Finally, Section 6, crucial mistakes to avoid.
We have to bust some serious old-school myths here with the 4 no's. First, no ice. Putting extreme cold directly on a burn severely constricts blood vessels and can actually cause frostbite. You are essentially adding a cold injury right on top of a heat injury. No way. Second, no butter or toothpaste. People love suggesting this one, but it is incredibly dangerous. These substances act like an insulating layer, trapping the heat deep inside the skin and actually forcing the burn to go deeper. Third, no breaking of blisters. Never do this intentionally. A blister is the body's own sterile, natural Band-Aid. It protects the raw, underlying skin from massive infection. Leave it intact. Fourth, no pulling stuck clothes. If a shirt or pants are completely melted into the burn, leave them alone. Pulling stuck clothes will violently tear away the skin right along with it, causing severe trauma and bleeding. Just let the emergency room doctors handle that part. So, having covered all of that, I want to leave you with this pivotal question. Is your home first aid kit properly equipped, and is your family genuinely prepared to assess and act in a split-second burn emergency? Knowing that a burn happens in mere seconds, but the entire trajectory of the healing process is dictated by those critical first few minutes, your preparedness is everything. Take this structured knowledge, memorize those 3 C's, ingrain the 4 no's into your brain, and make sure you are ready to be the ultimate responder when it matters most. Thank you so much for joining me today, and as always, keep learning.